Intake Packet for Three Mountains Regional Hospital by Amanda Inman. First thing is ethics and values. As a patient, you have the rights and responsibility. Our code of ethics will help you stay informed on your process while under our care and to help you fully understand the treatment you will be receiving. Ethics form an important part of our company's industry and the culture we want to imply in our atmosphere at our hospital. This packet will define our values and priorities. This packet will go into fine detail with the goal to help our patients to truly understand what we want to give them when choosing our hospital. Our hospital code of ethics. Number 1, patient relations. As a patient, you have the right to access treatment regardless of race, sex, religion, veteran status, or source of payment. Please notify the medical staff of a living will and for the medical staff to follow it. Knowledge of which physician that is primarily responsible for your care. Accept or refuse any form of treatment. Patients have the right to be informed of treatment and choice of language they can understand, voice any concern or complaints, and participate in their care plans and ask questions. Next, code of ethics. Physician activities. Their right to build trust relationships with patients, responsible to provide helpful information to help the patient to fully understand their medical condition and their option for treatment. They have the right to respect and care of the patient's medical information and keep everything confidential. And they also respect of the patient's values, goals, decisions, and preferences. Next code of ethic is patient's medical records. We never will share your chart unless given us written permission. We have 30 days to obtain your request to give you another medical office your chart. Every patient has the right to their own medical record. Patients have the right to get a list of who has seen their medical record at our hospital. They have the right to have someone act for you. They also have the right to file a complaint if they believe their privacy rights have been violated. And we can share your chart for billing and payment purposes, such as sharing with insurance companies to gain payment for services provided by the hospital. Next code of ethics is communication, including social media. Employees should understand that they are the face of Three Mountains Regional Hospital. Their actions, both good and bad, reference our company. Employees should always use their best judgment at all times. Social media is discouraged while clocked in. All employees need to get appropriate permission before you refer to posting anything work-related on any types of social media. And Three Mountains Regional Hospital computers are the only used for business purposes. Patient safety is the next code of ethics we're going to discuss. And patient safety is our number 1 priority. Always promote safe care and continue looking for ways to improve it. Staff always check ID bands before giving medication or doing a procedure. We have an infection prevention program in place. We know germs are everywhere, so let's work together to stop the spread of them. Always wash your hands throughout your shift. Hand washing is the number 1 way to stop the spread of germs. And if the patient is a fall risk, this needs to be noted outside of the patient's door, and staff needs to check on the patient regularly. Now, the purpose of an intake packet is for our past, current, and future patients to help establish patient trust in our hospital. This is our guidelines. These are our values and what we want them to be expressed. The patient helps address patient's concerns. Next thing to be discussed is the privacy policy. We are committed to protecting your privacy, so we have adapted privacy practices to protect the information we collect from you. Privacy and consent. Have the right to get a copy of this privacy notice. Request conditional communication from the medical professional taking care of you. You have the right to tell us your preference on what and who to share your medical information with. If there is a known person you do not wish to share this information with, please contact a nurse immediately. You have the right to file a complaint with the U.S. Government of Health and Human Services Office for Civil Rights. There's the phone number if you feel your privacy rights have been violated. HIPAA. HIPAA is insurance, a health insurance Probability and Accountability Act that was passed by Congress in 1996. HIPAA helps establish national standards to all healthcare providers and healthcare insurance companies. HIPAA helps provide health insurance coverage for Americans, workers, and families when they change or lose their job. HIPAA helps reduce healthcare fraud and abuse. It's a security electronic health info with standards protecting the confidentiality of individuals. HIPAA provides a privacy rule to ensure that patients' health information is properly protected, all while promoting high-quality healthcare. Last but not least, HIPAA gives the patients greater access to their medical records and have more control over how they are used. Last thing now is to be discussed in the intake packet is that the patient has received this intake packet and that they are knowledgeable of the intake packet. By signing below, I acknowledge that I've received a copy of Three Mountains Regional Hospital Code of Ethics. By signing that line, I am agreeing the consent and releases described on this form. I have read this consent and have been able to ask questions. So that is our intake packet here at Three Mountains Regional Hospital. Any further questions, please come see me or forward me an email. Thank you so much, everyone. Have a great rest of your night.